Okay. Yes. Good evening, all. After a long time, we are on to the session. Is my voice is audible? Is my voice is audible? Yes, I am viewing all you people in your comment box. You can comment without asking question. People started answering. Yeah, this was the courage. Yes, you are. So coming on to the first question, we are having some good audience, some 13 plus audience we are having, so that we can proceed, I guess. Okay. The first question is the adjuvant. Okay, which adjuvant is commonly used in DPT vaccines? Calcium carbonate, aluminum hydroxide, sodium chloride, magnesium sulfate. Hope this might be a basic question for your people. Okay. This has to be taught to all the audience so that you will have the clarity. So first we have to discuss what is this adjuvant. So it is the process, like it enhances the immune response. What it does, it enhances the immune response by stimulating what antigen and antigen presenting cells and prolonging the antigen exposure. So what going to happen to betterment of antibody protection? Antibody protection. So the answer is B. So why not answer is A or C or D? So let us discuss that. Okay, yes. So calcium carbonate, it is not the vaccine adjuvant here. So it is used for antacid purposes. So coming on to the sodium chloride, you all know it is a isotonic solution used for diluent purposes. So what about the magnesium sulfate here? So it is used for, it is an uterotonic agent. We can use it for eclampsia. So this is not a used for vaccines. So the answer is aluminum hydroxide here. So major purpose is that it enhances the immune response by stimulating the antigen presenting cells and prolonging the antigen exposure to make the viability of the vaccine and also to enhance the vaccine permeability here. So we are using this adjuvant. The example that we are using is aluminum hydroxide. Especially we are using it for which vaccine? Anyone can tell me? Yes, it is used for diphtheria, pertussis, and tetanus vaccines mostly. So this will be your possible question. Okay, it can be asked in basics. So for MSc, okay, for MSc, we can expect this type of question in your exam questions. Okay, yes. So coming on to the next question here. So minimum age for administration of the first dose of rotavirus is. So come on, tell me. First, tell me for what rotavirus is given. Yes, come on. So here we are going to discuss some basic questions. Okay, uh, basic to moderate, then advanced questions are also there based on the recent pattern of a MSc exam. Also, I have compiled some important NOSET questions here, so which is mandatory that you should know. These concepts are must know. For example, this immunization, like Anemia Mukt Bharat program. So some sort of basic questions plus advanced questions which are expected to be in your exam paper. So from this, possibility of questions are more. I am sure on that. Okay. Yes. So answer came Satyam Makava. You're right. Yeah, it is right. So first we are going to get quick. Okay, that's fine. For what gastroenteritis? To prevent this gastroenteritis, we are giving this rotavirus, especially against rotavirus. Only the target age group, which are the most high risk population here, infant till infant till 2 years. These are vulnerable population here. Target, we can say, most high risk for this rotavirus affected. Okay, then it causes gastroenteritis that we all know. What is the dosage here we have to give? This 5 drops. 5 drops we are going to give as well as per oral route. Never ever forget this because repeated question. Now it is also included in open vial policy. So what is this open vial policy? OVP, sorry. Open vial policy. Open vial, once we are opening the vial vaccine, so there is a guidelines that we have to discard the vaccine once it is administered. So the open vial policy suggests us on the optimum temperature on the given guidelines. If we are saving the vaccine properly, if we are storing the vaccine properly, then we can use up to 4 weeks, that is up to 28 days. So that we will be discussing. First, we have to discuss what is the minimum age for administration of the first dose of rotavirus vaccine. So that is what? That is sixth week. Okay, yes. 2.5 ml or 5 drops. Yes, correct. You're right. 2.5 ml or 5 drops. Yeah, correct. You're all right. Yes. Shall we move? Next question is clear. Okay. So now tell me here, a person with no sign of disease but may transmit is called as. So it is from the basics of epidemiology that we are going to discuss. A allergic person, a resistant, a immune person, a resistant person, and a carrier person. Now tell me, a person with no sign of disease but may transmit a disease. It is called as. My voice is breaking. My voice is breaking. Now it is fine. I think now it is clear. Yes, now I think it is clear. So here you all know that that is no sign of a disease but may transmit a disease. So it is a carrier person. So what about an allergic person? What about an immune person? What about the resistant person here? Yes. If it is an allergic person, if you are administering any vaccine or administering any antibiotic, before that we have to ask the patient, okay, you are allergic to some other thing, if you are allergic to certain foods, so for that we are going to administer the test dose. The best example that for immune mediated, that for hypersensitivity reaction we are having immediate reaction, which immunoglobulin is going to be released. So it is IgE antibodies, it is going to be released. Okay, E sign of counts will be high. So that is for allergic person, always it will be there. If it is a delayed hypersensitivity, then we are naming it as cell mediated, that is type 4 hypersensitivity reaction. So coming on to the immune person, तो थोड़ा सा हिंदी बोल Hindi. So this is commonly for all India audience. So we are going to cover pan India audience, so that here today's class will be mostly of uh, mode of language is English. Okay. Coming on to the immune person here. So what does this immune person suggest? So they are totally immune against particular disease condition, so that they will not transmit the disease. Okay, they will not transmit the disease. A resistant person. This also correlates with the immune person also, as well as a carrier person. So iceberg's phenomena suggests that asymptomatic carriers are submerged. Okay, we are having it. Okay, consider this is a sea. So mostly asymptomatic carriers or subsided. Okay, these are infected people. The tip suggests. Okay, this is the given example. I hope it is clear. A person with no sign of disease but may transmit a disease, then it is called a carrier person. Okay, now a flu is happening in a particular community, outbreak is there. Then if the person, see, there are two group of people, for example 25 group of people and 25 group of people. 25 group of people are affected by a particular fever or flu, then they will be showing the symptoms. So what happens if a 25% don't, from the 25 person group, one person is a carrier and it is going to transmit a disease to the other group, because there is no symptom, there is no sign, so easily there is chance of spread of infection, that we are naming it as chain of infection. For that only we are having guidelines and protocols. We have making a guidelines that for this conditions, for this fever, we have to make sure the community area people is quarantined or vaccinated. For prevention, for breaking the chain of transmission for typhoid or cholera, what we are going to do? Yes, we are going to make proper water sanitization measures. So that is the important thing that you should know, because these are very simple question in your exam. So what is the first and foremost, as per community guidelines, what is the first and foremost for cholera outbreak a community health nurse should know? First, we have to break the chain of transmission by promoting the water sanitization measure. That is the important thing that you should know. Okay, shall we move on to the next question here? Okay. Now ICDS question came. So what is this? Integrated Child Development Services. So every year there will be one question, definitely. So every year there will be one question. So there is no doubt. This year also I am expecting this type of questions. Okay. So coming on to the beneficiaries, always we have to remember. So overall the beneficiaries here, a pregnant woman, lactating mothers, children 0 to 6 years of age, and adolescent girls. Pregnant woman, lactating mothers, children 0 to 6 years of age, and adolescent boys. Pregnant women, lactating mothers, children 0 to 15 years of age, and adolescent girls. Pregnant women, lactating mothers, and children 0 to 3 years of age, and adolescent girls. Okay, last year, what question came? They have asked about particularly the children. Okay, this time they may confuse you between the boys and girls. Always remember adolescent girls, lactating mothers and pregnant women are the beneficiaries of ICDS. Okay, yes. Is it clear? So no D. Satyam Makawa, you are right. Yes. I think it is clear now. Yes, girls. Okay, is it clear? Shall we move on to the next question? These are the important thing that total calorie requirement is very important for you all people. Okay, total calorie requirement for children, it is 500. What is the protein requirement here? 12 to 15 gram. 12 to 15 gram. Coming on to the severely malnourished children. Here 800 calories, kilocalorie, and it is 20 to 25 grams of protein per day. And pregnant and lactating mothers is 600 calorie and 18 to 20 gram. Never ever confused. You should not be confused. Be clear. You should be have a clarity towards this type of concepts. Okay. Yes. What is the beneficiaries? That is children and severely malnourished children. How we are going to categorize with the help of this Shakir tape? We are going to categorize the patient. So categorize the children whether they are under malnutrition, whether they are severely malnourished or not. Whether if it should be what is the target here in the Shaki tape, which is the green zone? Yes, come on. Now you should tell which is the green zone here. Shaki tape, green zone. What is the green zone? What is the green zone here, children? What is the green zone here? It should be 12.5. If it is less than 11.5, yes, 12.5 or greater are considered as green zone in Shakir tape. Okay, it is especially for under 5 children. Okay, 0 to 6 years also we can use. Okay, is it clear? Shall we move on to the next question? Now comes the controversial plus important question. Okay, what is the iron and folic acid dosage for adolescent population irrespective, that is 10 to 19 years of age? Here you can, if you have a time, you can go and check our, that is National Health Mission website. In that we are having anemia mukt bharat, the first important. Then weekly iron and folic acid supplements. So we are having 2 pages here. Okay, these are updated guidelines. Okay, first thing that these are updated guidelines which I referred from National Health Mission in our Indian website, Indian as per the government guidelines. So here what this weekly iron and folic acid supplement says, we have to give 100 mg of 100 mg of elemental iron plus 500 mcg of folic acid. Okay, that is weekly iron and folic acid supplement. Don't answer, children. Just wait. As per Anemia Mukt Bharat program, here we are following 6 into 6 into 6 strategy. Here, what Anemia Mukt Bharat says is we have to give 60 mg of elemental iron and 500 mcg of folic acid, that is weekly. Okay. So what is the question? What is the controversial? What is the confusion here? If they are mentioned under Anemia Mukt Bharat, they will specify now onwards. Please be clear. If they are specifying anemia mukt Bharat, we have to give 60 mg of folic acid, elemental iron, and 500 mg of folic acid. But they have mentioned this weekly iron and folic acid supplement under National Health Mission. If they are asking specifically this, then it is 100 mcg of, that is 100 mg of elemental iron plus 500 mcg of folic acid. So this is the difference you have to identify and you have to answer. The first and foremost thing is first identify the in the keyword. You have to identify in the question. Then you are having confusion, then you can go. So as of now, I have taken this question from the previous year Q bank. It suggests that it is 100 mg of elemental iron. So the answer is here because it is from weekly iron and folic acid supplement. From now onwards, if your prospective question paper like upcoming exams, if they're asking about generally about this iron and folic acid dosage, then you have to click this 60 mg of elemental iron and 500 mg of folic acid, unless otherwise if they are specifying the component from where they are asking. If it is from anemia mukt Bharat, then 60 mg. If it is from weekly iron and folic acid supplement, then it is 100 mg. Is it clear? Is it clear for you all now? So what is the answer for this question, sir? Now it is A. Why? Because it is taken from weekly iron and folic acid supplement. Okay. If you want more content, more clarity, then you can log in. You can go to the Google. You can verify that under National Health Mission, there is two components, that is Anemia Mukt Bharat as well as weekly iron and folic acid supplement. You can see that. Okay. So never ever do that. Please be cautious while you are answering the question because these are very important and controversial questions. Okay. Shall we move on to the next question here? Okay. So coming on to the next question, early feature of vitamin A deficiency. So now it is easy for you all. Now we are going to discuss about the gradings here. So which gradings, which is going to be the feature, clinical sign. We are going to discuss that. Is it clear? TB, conjunctival cirrhosis, no Asian A, Satyam Makawa, Makhana. Sorry, sorry for my pronunciation. I will call it as Satyam. Okay. Shakshi, yes, you are right. Yes, yes. Come on. I need all of you to answer because we are having some good audience now. It is increasing. Yes, it is happy for me that. So now they are asking about the early feature. First and foremost, we are having gradings for vitamin A deficiency. First of all, what is the dosage for infant? That is for till infancy. We are going to give 2 lakh international units. That is 2 ml syrup for vitamin A we are going to give. What about after 1 year? After infancy, till how many years we are going to give 1 lakh international unit? So that is my first question. You can put the answer in the comment box. So coming on to the answer, before going to the answer, we are going to discuss the gradings. So now I am going to discuss the gradings. Okay. First XN. What is this XN? It is night blindness. Yes, sorry for the network glitch. Now I think it is visible and audible. So first we have to discuss about the gradings. So as I discuss gradings. Yes. XN we are having. That we are naming it as night blindness. Just listen, no need to take any notes. Just listen what I am explaining.
First, we
First,
have
we have
to
to
understand
understand
that
that
vitamin A
vitamin A
deficiency, we are
deficiency, we are
having
having
long-standing
long-standing
deficiency
deficiency
and
and
acute.
acute.
Where
Where
there is
there is,
if
so
the
if the
vitamin A
vitamin A
deficiency is there,
deficiency is there,
obviously the
obviously the
gain it
gain
is
it
going
is
to
going
cause
to cause
blindness.
blindness.
Before that,
Before
we are
that, we are
having
having
gradings.
gradings.
So
So
this
this
time they
time
may
they may
focus you
focus
on
you
the
on the
gradings.
gradings.
Okay.
Okay.
First,
First,
XN if
XN
they
if they
ask, that
ask,
is
that is
for
for
night
night
blindness.
blindness.
N
N
stands
stands
for
for
N.
N.
If
If
it
it
is
is
X1A,
X1A, then it is conjunctival
conjunctival
cirrhosis. Cirrhosis.
cirrhosis.
So
So where
where
there
there
will
will
be
be
dull,
dull,
come
come
on,
on,
thickened
thickened
and
and
wrinkled
wrinkled
conjunctiva will
conjunctiva
be
will be
there.
there.
Dull,
Dull,
thickened
thickened
and
and
wrinkled
wrinkled
conjunctiva.
conjunctiva will be there. Reduced tear secretion. So it is also long-standing deficiency. Both the things are long-standing. So coming
Coming
on
on
to
to
X1B,
X1B,
it is Bitot spot. So
so
what
what
is
is
this
this
Bitot
Bitot
spot?
spot?
Foamy,
Foamy,
white,
white,
gray,
gray,
triangular
triangular
patches. If
patches.
they
If they
ask
ask
about
about
triangular
triangular
keratin
keratin
patch.
patch.
Yes,
Yes,
sorry
sorry
children.
children,
Yes,
yes,
give me
give
a
me a
minute.
minute.
Yes, now I think it is clear. Yes, now I think it is clear. Fine. Finally, okay. Yes, now it is clear. So coming on to the X1B Bitot spot where triangular keratin patch, the word comes, keratin derbies will be there. Debris. Keratin debris will be there. It is also a long-standing thing. It is also a long-standing thing. Okay. The next slide I will be posting so that you can take these screenshots. You can use for your notes. So coming on to the X2, it is having corneal cirrhosis. Corneal cirrhosis where there will be dull cornea. The key feature is dull cornea. So what is the next term? It is also acute. It is acute blinding risk more. The blinding risk is more in X2. So coming on to the X3A, the category X3A, corneal ulceration. The word itself tells that ulceration is there, shallow, that is punched out ulcers you can see. Okay, punched out ulcer. Okay. Okay, sorry for my now I think everything is fine, right? My voice is clear, video is visible, I guess, and my explanation which I am giving it is clear. So coming on to X3B, it is Malaysia, where there will be rapid progression to perforation and blindness. So we are naming it as, which is a danger sign. So we are naming it as severe acute and high mortality rate is there. Okay, high mortality rate is there. Yes, I clear, you clear. Now it is all clear. Thank you, Asian Asiaman Zoo. Thank you so much. Yes. So coming on to the next, it is X5. X5 is corneal scarring. So permanent corneal opacity will be there, headed by ulcer. Okay, this is the consequence. It is the irreversible stage of deficiency of ulceration. So which is the irreversible stage starting, that is X5 corneal scarring. XF we are having, that is xerophthalmic fundus, where the retina becomes changed. That the fundoscopic examination, you can see the retinal changes, and which is more common in chronic deficiency. The word comes chronic deficiency, then it is xerophthalmic fundus. Don't ever think that is night blindness, which is the earliest feature they are asking, that is night blindness. Okay, what is the complication? If they ask about complication, end, that is blindness. If they're asking irreversible, then it is corneal scarring. So, which is the consequence of keratomalacia? If they're asking, that is also corneal scarring. Okay, if they're asking about ophthalmic fundus, then it is the important thing due to chronic deficiency of vitamin A, then it is going to do this. Okay, so what is the dosage? If they ask, where we are going to give 2 lakh, where we are going to give 1 lakh, that is the important thing that you should know. If it is infant, 1 lakh. If it is more than 1 year, then it is 2 lakh. It is simple. Every 6 months we are going to give, that is 2 lakh international. Okay, is it clear? I think one of our students have answered this correctly. Yes. Burman, yes. Sika Burman, you have correct. You have answered correctly. Asman Nuzur, you are also answered correctly. Yes, correct. Every 6 months we are going to give. Okay, yes. Is it clear? So the grading is very important. Next slide, I'll be projecting for from 5 to 10 seconds. You can take the screenshots. Okay, yes. Yes, you can take the screenshots. This is the important thing you should know. Okay, yes. So here, this keratomalacia, I can underline here. It is severe acute high mortality. Yes, high mortality. That the total doses, the international units, the lakhs, everything people knows. But this is the important thing that you should know, which are going. You should update yourself, right? If they're asking about the simple question, I will say, what is the complication of vitamin A deficiency in acute phase? If they're asking about acute phase, then it is corneal cirrhosis. Acute phase. Okay. If what is the earliest sign of vitamin A deficiency, if they ask, that is night blindness. Earliest. The keyword is very important. Earliest. So what is severe acute vitamin A deficiency? Severe acute, a word comes, then here comes where there is a high mortality rate, then it is keratomalacia. When we talk about this xerophthalmic fundus, it is the end stage actually, because due to the chronic deficiency, if they have put a word chronic deficiency, then it is xerophthalmic fundus. So what is the end stage? What is the complication of vitamin D deficiency if prolonged? Blindness. Obviously, the end is always blindness. The grading is very important. Sometimes they may focus on the gradings, so that I have underlined all these concepts. Okay, is it clear? Okay. So now tell me, what is the next question? Is it clear? What is the dosage for rabies vaccination as per post-exposure prophylaxis? So here we are following like rabies. WHO have categorized category 1, okay, category 1, category 2, and category 3. So that is one important thing. When we talk about category 1, there will be mild abrasions. Okay, only saliva licking will be there. No bleeding or nothing. When we talk about category 2, mild abrasion, there is chance of nail. Okay, nail and saliva is present in the particular area. When we talk about and some sort of minimal laceration, always understand the difference between abrasion and laceration. Okay, abrasion and laceration. When we talk about this abrasion and laceration, where there is a mild skin, um, there won't be skin peel, okay, less than 2 centimeter or 5 centimeter. If there is a spread of wound is there, like mild skin peel is there, then we are naming it as abrasion. When there is a cut more than 1 or 2 centimeter, then we are naming it as laceration, where there is a chance of bleeding. If the laceration or done by the dog bite, it's the web to the victim. Okay, then we are naming it as category 3. Category 3 is like bite will be there and there is chance of nail also. Okay, then there is minimal to moderate to severe wound is there. Then there we are naming it as exposure. This is the category of exposure towards the rabies. Always you will be knowing when the patient is having rabies in CT, which component is seen. So that is what? Come on, tell me. Yes, I am looking in the comment box. Yes, come on. For this, negri bodies. Negri bodies will be present. Okay, that is one another one important MCQ. Here, in this component, for example, this rabies, we are having two regimens. That is in regimen. Is in regimen, and we are having updated Thai regiment, Thai Red Cross regiment. So which we are following here? So now as per updates, we are following this updated Thai Red Cross regiment. Yes, Thai Red Cross we are following in our primary health centers. If you are going like a private thing, private clinics or private hospitals, there they are recommending this Eason regimen. But as per our protocol, we are following this updated Thai Red Cross regimen. Here, Eason regimen, we are giving in intramuscular, that is IM. Here, updated Thai Red Cross regimen, we are giving intradermal. Okay, now we are going to discuss the important things of this Asian regimen and Thai Red Cross regimen. Be cautious. Now I am going to give you only the key points. This Asian regimen. First, we are going to discuss this Asian regimen. Total number of visits is 5 visits. Okay, 0, 3, 7, 14, and 28. So this is one thing. So now we are having 1, 2, 3, 4, 5. So if the word comes with 5, for example, the options, option A till D, they are having this 5 visits, then the question is given from ESIN. This is the important keyword that you should know. They will not give the ESIN regimen or Thai Red Cross regimen. They will give as like the options. If the options are similar, option A is having 5 visits, option B is also having 5 visits, option C is also having 5 visits, option D is also having 5 visits, then you can predict that okay, it is from Eason regiment. If it is 4 visits, then it is easy, that is Thai regiment. Here it is mixed. Okay, you can see 4. Here it is 5 and it is 4. So majority is 4. Whether you can correlate, whether it is correlating with 0, 3, 7, 14, 28. No, it is also not there. It is also not there. So option C is not here. So Eastern regimen follows 5 visits, intramuscular route, and one full vial is 0.5 ml. So here we are having purified virocell rabies vaccine we are going to give. And what is the route that I have discussed? That is intramuscular. So what is the site here? What is the site? Deltoid. First is deltoid or anterolateral thigh in children. So what is the total volume if you are telling? Total volume is 2.5 ml. 2.5 ml if 0.5 ml vaccine. Or we can give 5 ml. If the total vial of vaccine is 5, then 1 ml vaccine we can give. Okay, this is for Eastern regimen only. Okay, is it clear now? So now we are having updated Thai regimen. Updated Thai regimen. Here we are having 4 visits. Is it easy? 0.1 ml. Two sites we are going to give, like right anterolateral, right deltoid and left deltoid. I am going to give intradermal route. What is the dosage? 0.1 ml per site. I'm going to give, and it is total doses are what? 4 visits in the sense 8 doses. I am going to give. 8 doses I am going to give. Intradermal route. Okay, deltoid region I am going to give. So what is the date? What is the particular days I am going to call the patient? 0, 3, 7. Here we are having the confusion. 21 or 28. 21 or 28. Now see which option correlates our question. So what is the dosage for rabies vaccination as per the post-exposure prophylaxis? See, we are having pre-exposure prophylaxis and post-exposure prophylaxis. Now we are discussing only about the post-exposure prophylaxis, only category 2 and category 3 people, not for category 1. Okay, yes. It is 21 or 28. Mostly we can say 28. As per the update, it is 28. If the question comes like 21, then you can choose 21. But as per update, it is 28 only. So what option for it? Because it is from previous year question, I am giving you the update. Okay, I am giving you the update, that is 28. So now what is the answer? So now the answer is D. So now the answer is D. So for rabies, which regimen we are following? Updated Thai Red Cross regimen, intradermal route. This is more than enough for you. Okay, this is enough. From this only we are going to give they are going to ask the question. The only important thing that you should know, whether the question is from Eastern regimen or it is from updated Thai regimen. If they are giving 5 visits, then it is Eastern regimen. If they are giving 4 visits, then it is updated Thai Red Cross regimen. Okay, is it clear? So this is the important thing. So now comes the important, very every question paper. If you take nursing questions, every question paper have this question: secondary prevention, tertiary prevention, pre-model levels of prevention. Definitely there will be one question without doubt. So now I am going to clarify the concept, clarify the doubts in levels of prevention. Now we are going to learn nook and corners of all these concepts. Okay, levels of prevention. They are asking about secondary prevention. Here we are having primordial, primordial, primary, secondary, and tertiary. Okay, yes. So here easily you can detect. So early detection, diagnosis of the disease, and prompt treatment. So that is the answer. So what about the primordial prevention here? What about the primary prevention here? What about the secondary prevention here? When we talk about the primordial prevention, easily I will explain you. If there is no risk factor, we are going to destroy or we are going to demolish the risk factor only for the particular group of audience or a general population, then we can name it as primordial prevention. Okay, primordial prevention. Okay, Primordial prevention is management of risk factor here. Okay, risk factor prevention. Okay, for school going audience, I'm going to create an awareness regarding smoking and alcoholism and the health impacts. Then we are naming it as primordial prevention. Early identification of risk factor, and we are going to prevent the illness. Then it is primordial prevention. When we talk about primary prevention, in primary prevention, what we are having here, we are having health promotion, and specific protection. Here students are making mistake. Health promotion is health education only to the vulnerable population where the risk factor is there. For heart disease, for example, I am going to create an awareness for breast cancer only to the woman group for the particular age group. For example, 25, about 28 to 45 age group women, I am going to create an awareness regarding breast cancer, like breast self examination I am going to give. Then it is health promotion. Okay, when there is a specific protection is vaccination only to all the humans, like not only for the age group, for all the women I am going to create an awareness regarding breast cancer. Then it is health promotion to the public. Okay, health education I am going to give. When we talk about specific protection, wearing helmets wearing helmets, vaccination comes under specific protection. Only the particular condition, only the particular disease I'm going to prevent, I'm going to give the vaccination. Okay, like immunization. Okay, then it is specific protection comes under primary prevention. Coming on to the secondary here, screening. The word comes screening and early detection, prompt treatment. Hypertension, I have diagnosed and I'm starting treatment. Okay, then tertiary prevention. Here, I am going to take rehabilitative measures. Sorry, rehabilitative measures. Okay, this is tertiary prevention. When we talk about BP measurement here, I will give you the clue. BP measurements, blood pressure monitoring. When there is no risk factor, okay, if the family age group are there, okay, if the family age group are there, I'm going to assess the BP. Then it is primary prevention. When we talk about secondary prevention, risk factor is there, age group is there. Then if I am checking BP, then it is secondary prevention. I am diagnosing, okay, there is chance I'm going to do screening for a particular age group in a particular community. Then it is secondary prevention, BP. This is some advanced question. I am talking about advanced question. Okay, BP measurements are correlated with primary, secondary, and tertiary. Okay, tertiary prevention. When we talk about tertiary prevention, for example, a patient with stroke, okay, rehabilitation have been started for their prompt action and treatment. Okay, I'm going to assess BP, then it is tertiary prevention. Okay, for further preventing complication, then it is secondary. Complication have arrived, then I'm going to do a maintenance, then it is tertiary. Okay, is it clear? Rehabilitation facility is disability limitation is there, obviously. Yes, correct. Occurrence before the risk, yes, correct. Zur, you are correct. 5606, you are correct. Yes, it is clear now. Shall we move on? Is it clear for you all about the secondary prevention? Like our primordial, primary, secondary, and tertiary prevention. Is it clear? Yes, thank you so much. So now here safe water supply, vector, animal reservoir control. Now tell me which level of prevention is this? Good living and working condition. Nutritional counseling comes under which level of prevention? Nutritional counseling. Yes, we will have some good 2 minutes time. Now we are going to, because this is very mandatory question where most of our students are making mistake. Even I did mistake when I was giving the exam in my beginning stage. safe water supply, vector control, and reservoir control. Where we are breaking the chain of transmission, because vector and animal control reservoir like anemia awareness. So now tell me, what is the malaria awareness month and dengue? Malaria month, yes. What is the malaria month? Is, come on. Malaria comes at June, so my students will know, and dengue comes at July. So this is the important thing that you should know. Month, I am talking about month. No, it's not November. Yes. Malaria is on June, dengue is on July. So this is the important thing that you should know. Okay. So coming on to the nutritional counseling. Nutritional counseling comes under specific protection only for malnourished children. Malnutrition children, this is the target population I'm going to give. So this is primary prevention. It is primary prevention. Is it clear? Okay. June, July. Yes, correct. Now it is easy for you all people to understand. Primordial, primary, secondary, and tertiary levels of prevention. From this, definitely one question. One question is compulsory. Whether it's been MSc, it's been NORCET, or any sort of nursing officer exam, there will be one question. Please be cautious in attending, because I am just giving an example of BP measurement. You should apply your knowledge while you are answering. This is an example. Okay, early diagnosis. Simply they will give testicular self-examination. Is I am going to perform, like I am educating to the audience, or I am asking the audience to perform in a private area, privacy area. I'm going to give. So when I am doing the screening, it is secondary. When I am giving the awareness, it comes under primary prevention. Okay, screening is totally different here. Okay, yes. So coming on to the next question. This is the next question. Level of care is oriented towards the promotion and maintenance of health, the prevention of community disease, the management of common episodic disease, and the monitoring of stable or chronic condition. It might, you may think that it is a very big question. Okay, this is a very big question. How I am going to answer? Now tell me. Yes. Here you should identify the keyword. If you are identifying the keyword, then it is very easy. So first and foremost, they are asking about the level of care. Now you have learned about primary, secondary, tertiary, and primordial. We have learned. Okay, when it is no risk factor or minimal risk factor, when we are analyzing with the future, then we are naming it as primordial. When there is a risk factor, I'm going to give health promotion and specific protection activity, then it is primary. When I'm going to do screening and to take prompt action towards the particular medical condition, then it is secondary. When the complication have arrived, then I'm going to do rehabilitative measurements and disability limitation, then I'm going to do with tertiary. Yes. Now tell me here, which is oriented towards the promotion and maintenance of health, where there is a keyword prevention of community disease and management of common episodic disease and monitoring of stable or chronic condition. I'm just going to do monitor here. What is the keyword here? This is the controversial thing: monitoring of stable or chronic condition. Here this is very important here. What? Promotion and maintenance of health. Health promotion I am going to do, and maintenance of health I am going to do. Okay, when the word comes health promotion, it is primary prevention. This is the keyword. This is the keyword. So the answer is primary care level. When the word comes, it is a diagnostic or screening, then it is secondary. When there is an advanced care, so we are not having any advanced care here. This is the distracted they have given. Tertiary, here we are having rehabilitative. Rehabilitative. Yes. Is it clear? Okay. So coming on to the next important question. Yes, very important thing. Here they have given which one of the following is the indicator of prevalence of contraceptive practice in the community. Yes, come on, tell me. Couple protection rate or total fertility rate or general fertility rate or net reproduction rate. This C. Okay. So what is this prevalence? So contraceptive failure we are going to assess with what? So have you learned about this Pearl index? Yes. If you are all correct, yes, it is couple protection rate. So what it does that? So what it is the couple protection rate? So this couple protection rate measures the percentage of couples. Which method of contraception they are using. Okay, which indicates directly indicating the prevalence of contraceptive practice in the community. How far we have made the awareness, how much we are using the contraceptive method as suggested by the government, whether they are using barrier methods or they are using any protective things, or which level of contraception they are using, whether they are having the awareness regarding contraception or they are following the guidelines, everything. So this couple protection rate measures the thing. Very easy. Okay, just remember this. So now tell me, what is the total fertility rate, which measures the average number of children in a woman during her lifetime. Average number of children a woman would have during her lifetime. So that is total fertility rate. So coming on to the general fertility rate, it measures the number of live births. Number of live births per thousand women. Okay, this is thousand. I will write here again per thousand women. Okay, of reproductive age in a given year. Okay, this indicates the birth rate, but not the contraceptive practices here. Okay, it reflects only the birth rates. So this is general fertility rate. So coming on to the net reproduction rate. So net reproduction rate, it measures what it measures. Come on, anyone? It measures the number of daughters, the female population, a cohort woman. Okay, it may subject may vary about to the current fertility and mortality rates, but this is the important thing. It measures the daughters of cohort women would have in their lifetime. Okay, it is not the contraceptive practice here. So only thing which reflects towards the contraceptive practice, that is general couple, that is couple protection rate. So the prevalence of contraceptive practice in the community, that is couple protection rate. Is it clear? Is it clear for you all? Shall we move on to the next question? Shall we move on to the next question? Yes. So now comes another one important question. So I have given you the time. Which of the following types of undernutrition is indicated by Z score below minus 3 SD of the median, that is WHO child growth standards? So always we are having doubt. Always we are under doubt whether sir minus 2 SD I have confused. Minus 2 SD to minus 3 SD for standard deviation they have given Z score. I have confused whether it is moderate mild. Now I am going to clarify you all. Okay. First we have to identify, that is weight for height. Weight for height. When the word comes weight for height, that is wasting. Here we are having greater than or equal to minus 2 SD till greater than or equal to minus 3 SD till minus 3 SD standard deviation that we have. If it is more than, that is 2 minus 2 SD, then we are naming it as normal. When the word comes minus 2 SD to minus 3 SD, minus 2 SD is normal, right? Okay, minus 2 SD to minus 3 SD if they are given, we are naming it as moderate acute malnutrition, MAM. What type of malnutrition it is? Acute. Okay, wait for it is wasting. See, wasting, shunting, they have asked already. Now they will specify. They will give moderate acute malnutrition or severe acute malnutrition. That is the advanced level of question that is possible in your exam. When we talk about this minus 2 SD or minus 3 SD, then it is moderate acute malnutrition. So that is acute always. So that is acute. When we talk about minus 3 SD alone, I am talking about weight for height. They will give wasting or weight for height. That is the keyword. Then they will give this minus 3 SD or minus 2 SD. Weight for age is different. Height for age is different. Okay, weight for age is different and weight for height for age is different. Okay, while explaining, I am confusing. So just clarify that. Okay, now wasting. Now we are talking about weight for height, wasting. Here we are talking about moderate acute malnutrition. Okay, yes. Coming on to the minus 3 SD, here severe acute malnutrition. Severe acute malnutrition, it is acute. It is acute minus 3 SD. So this is only about weight for height, wasting. So here there should be specific height, okay, and for that height the weight has to be maintained towards the children. So that's what it suggests. So you simply are telling weight for height, what does this mean? So for example, a weight doubles at 4 years. So average weight of a children, it is like we can say 50 centimeter, we can say. 4 years, the child will be like 100 centimeter. For example, 100 centimeter, a child is having a height. For that, the child has to maintain. So weight doubles at 6 months. Okay, weight doubles at 6 months. For example, average weight quadruples at 4 years, 2 years, quadruples at 2 years. This is the important thing. For 4 years, the child average child weight is about, we can say, some 10 kgs or 12 kg. For example, I am just telling. If the child doesn't have that weight, doesn't meet the criteria, then we are naming it as malnutrition. So that we are naming it as minus 2 SD, minus 3 SD. Minus 3 SD alone, it is severe acute malnutrition. That is only applicable for weight for height, that is for wasting. This we can regain properly. If we are giving proper nutrition, then we can regain it properly. So that I am shouting for weight for height, so that you should have the clarity. When we talk about this height for age, now I am talking about height for age. When the word comes height for age, it is very, very important that it is something. Here, the same thing, minus 2 SD will be normal. Okay, minus 2 SD is complicated. That is normal. Okay, now it is between minus 2 SD and minus 3 SD. It is moderate shunting. Moderate. So what is the type of malnutrition here? Here in weight for height, that is weight for height, I have discussed that it is acute. Now always it is chronic. When it is minus 3 SD, what it is? It is severe shunting. It is also chronic here. It is also chronic here. Sir, what if more than if it sir there is no category called minus 3 SD more than, that is if it is more than minus 3 SD less than minus 3 SD, if they ask about this concept, less than minus 3 SD is not there, between minus 2 SD or between minus 3 SD, that is greater than, less than minus 2 SD and greater than minus 3 SD is there, okay, that is fine. If there any category that is less than minus 3 SD is there or not, here we are having the component. If edema is present, then it is the acute malnutrition is complicated. That is for weight for height. Okay, just listen. I will summarize once more. Okay, don't afraid or don't be confused. Just listen. If it is less than minus 3 SD, more than, when the edema is present, then the acute malnutrition is complicated. Edema present, important keyword, important. If it is minus 3 SD, less than minus 3 SD they have given, and edema, the word comes edema is there, then it is, that is the malnutrition is there and it is complicated. Acute malnutrition complicated, that is less than minus 3 SD and edema is present. Okay, is it clear now? That is for weight for height. Now here comes height for age. Here, if it is more than minus 2 SD, then it is normal. If it is less than minus 2 SD, or that is between minus 3 SD, then it is moderate shunting. Okay, greater than or equal to minus 3 SD, then it is moderate shunting. If it is minus 3 SD alone, severe shunting. So this is one important component, that is height for age, very very important, that is shunting. What for this? Height for age. For a particular age, there should be the height. 4 years, the child has to reach 100 centimeter. If it is not, still the child is in 70 centimeter or 80 centimeter or 90 centimeter, then we are categorizing the patient, that is children, as malnutrition children, and we are naming it as chronic. Okay, when for a particular age, if the height is not met, then the child is chronic malnutrition and it is shunting. Okay, when now we are going to discuss about the weight for age. Weight for age. Here we are having underweight, moderate underweight, and severe underweight. Here they have clearly mentioned weight for age. Only for a particular age, the child doubles the weight at 6 months. So now weight for age I am going to calculate. If it is more than minus 2 SD, then it is normal. If it is between again less than 2 SD and greater than or equal to minus 3 SD, it is, now I will write, okay, minus 2 SD between or greater than or equal to minus 3 SD, then I am naming it as moderate underweight. Then it is less than minus 3 SD. Again, then it is severe underweight. Sir, what type of malnutrition is there? So it is mixed. It is acute and chronic mixed. Okay. So this is the important thing that I have to, I want to clarify you people. Is it clear? Shall I summarize once more? Shall I summarize this once more? Okay. We will have a quick summarization now. See, they have asked about the Z score as per the WHO requirement child growth standards. So here we are having three components, that is weight for height and height for age and weight for age. So never confuse here. Weight for height is like for a particular height the child has to meet the weight. Okay, and if it is not, then we are naming it as wasting. Here we are having minus 2 SD. If it is greater than minus 2 SD in every component, like if it is irrespective, that is weight for height or height for age or weight for age, everything we are naming it as like normal. If it is more than, that is minus 2 SD. If it is between less than minus 2 SD and more than minus 3 SD or less than or equal to, when we are naming it as. For example, this is in weight for height component, that it is between minus 2 SD and minus 3 SD. We are naming it as moderate acute malnutrition. It comes under acute. When we are talking about minus 3 SD, minus 3 SD, severe acute malnutrition. Minus 3 SD alone, less than minus 3 SD alone, severe acute malnutrition, it also comes under acute. When there is edema present and the Z score also minus 3 SD, then it is complicated acute malnutrition, edema present. This is the important thing I am expecting in this MSc exam as well as in NOSET. Okay, yes. Now the weight for height component is over. Now height for age component comes with shunting. STUNTING. Okay, shunting. So now minus 2 SD is normal. If it is greater than or equal to minus 2 SD is normal. When we are talking about minus 2 SD and minus 3 SD, if it is less than minus 2 SD and greater than minus 3 SD, then it is moderate shunting and type of malnutrition is chronic. When we talk about minus 3 SD, minus 3 SD alone, severe shunting and it is chronic. Here we are having no more component like edema present or not, that is not a matter here. So coming on to the weight for age, for a particular age, the child has to meet the weight. For that, we are having only moderate underweight and severe underweight. If it is between minus 2 SD and minus 3 SD, then it is moderate underweight, it is mixed, whether it is acute or chronic. When it is minus 3 SD, severe underweight, we can name it, and it is a mixed type of malnutrition. Is it clear? Okay. See, three things you have to remember. Wasting comes under, that is weight for height, wasting. When it is height for age, it is shunting. This is the important thing. When they talk about weight for age, then it is totally different. That is underweight component. Why I am specifying the moderate malnutrition, severe acute malnutrition, because acute and chronic you will confuse. You will be confused. So if the word comes wasting along with edema, then it is acute malnutrition and it is severe acute malnutrition which is complicated. Okay. Is it clear now? So for your better understanding, is it clear? Shall we move on to the next question? Yes. So now next question. Open file policy. Open file policy is applicable for which of the following vaccine? So now open file policy, now we are going to discuss. I hope seven members are watching, and more than I think 20 members have watched the video. We are having good number of likes also. Yes, I need all your inputs. Come on, tell me. I am on the chat box. You can ask your doubts, everything, so that I will clarify your doubts also. Okay, now we are going to see about our 12th question. Open vial policy is applicable for which of the following vaccine? It is BCG, DPT vaccine, oral polio vaccine, MR vaccine, pneumococcal conjugate vaccine. So this question, we are going to discuss what is this open vial policy. Then we are going to back to the component. Okay. Open vial policy can be applicable, can be reused. The important thing is we can reuse the vaccine. We have to store the vaccine in the particular temperature or optimum temperature, and we are having one important thing, that is vaccine vial monitor. Okay, with the help of color coding, we are going to identify whether the vaccine viability is there or not. Open vial policy, we can use up to 28 days. One MCQ. So, what are the vaccine comes under this? OPV, IPV, pentavalent vaccine, hepatitis B, diphtheria, pertussis, tetanus, because pentavalent is already there, and tetanus. TD we can say, tetanus toxoid vaccine. So these are the vaccine can be used. Okay, we can be used for applicable for open vial policy. Here we are having which is most freeze sensitive vaccine, which is most heat sensitive vaccine. Like we are naming it, if OPV, we have to store in deep freeze vaccine. We have to deep freeze minus 20 to minus 25 degrees Celsius. So it is the heat sensitive vaccine, which is that is freeze sensitive vaccine that you people are going to comment. See, MCQ I am not discussing. First, we have to identify. First, we have to learn what is open vial policy and what are the vaccine applicable for open vial policy and which are the vaccine are not applicable for open vial policy. So, not applicable. So, not applicable. We have to discard the vaccine within 4 to 6 hours. Within 4 to 6 hours, we have to discard the vaccine. Is it clear? We have to discard the vaccine. So what are the vaccines here? BCG, measles, then Japanese encephalitis, reconstituted vaccine. Okay, reconstituted vaccine, and any single dose vaccine, like any reconstituted vaccine we can use. Okay, single dose vaccine, for example, I think some of the COVID vaccine or single dose vaccine, where we have not used this open vial policy here. Okay, single dose vaccine, open vial policy, we should not use. We have to discard it. It's a once use vaccine. Okay, here this measles and BCG within 4 to 6 hours after reconstitution we have to use, or else we have to discard the vaccine. So other vaccines open vial policy is applicable. Now tell me, we are having OPV. Yes, OPV is there. Where is OPV? Here we are having diphtheria pertussis there. Yes, we are having measles. No, measles we should not use. MR vaccine, measles, rubella we should not use. Open vial policy is not applicable. So pneumococcal conjugate vaccine, it is there or not? Yes, 2, 3, 5. Pneumococcal vaccine is also there. So what are the vaccines? 2, 3, and 5. What is the option? Option A is the correct answer. Is it clear? Shall we move on to the next question? Shall we move on to the next question? Yes, come on. Okay. Now we are going to see about the next question. Which of the following carriers continuously shed the organism? So now I will give you the enough time. Pseudo carriers, chronic carriers, convalescence carrier, healthy carriers. Yes. Come on. We need proper answers so that we will discuss the distractors also. Which of the following carriers continuously shed the organism? Pseudo carriers, chronic carriers, convalescence carrier, healthy carrier. So now the carriers continuously shed the organism. If the word comes continuously, then it is chronic carriers. Sir, what about the pseudo carriers? What about the convalescence carrier? What about the healthy carriers here? So first you have to identify, learn what is this chronic carriers. So they will excrete the organism for indefinite periods. For example, hepatitis B, where we'll be having the viral load, the titer count will be monitoring, and malaria also. So they will recover. They will be recovered. Actually, they will be affected. Symptoms are exhibited. They will be recovered, but they will be keep on transmitting the disease, not in the recovery phase. They will be keep on transmitting the disease for long period of time. Then we are naming it as chronic carrier. So that continuous word, continuous shed of organism. So that it is called as chronic carriers. So when we talk about the pseudo carriers are avirulent organisms. So have you learned a word about biowar? So what they will do, they will cultivate they will cultivate the microorganism in a particular host, for example, a human, and it will not cause any harm to the human, but they can transmit. So that is called pseudo carriers. So this will be your new word, pseudo carriers. So when we talk about this conversion carrier, here already the name comes conversions. When the person got affected to a particular infection, for example, the typhoid or cholera, here we are having a stages like a conversion stage, recovery stage. During the recovery stage, when the infected person, they have got treatment, they have infected, they got treatment, okay, then they will transmit the disease. When they will transmit the disease during the recovery phase, then we are naming it as conversion carrier. So what is about healthy carrier here? When we talk about the healthy carrier alone, here healthy carrier means what? They will have a disease, but they will be asymptomatic. They will be asymptomatic, and they will transmit the disease. So that is healthy carriers. Okay, is it clear? When it is continuously keep on transmitting the disease over long period of time, then it is chronic carriers. Okay, is it clear? Shall we move on to the next question? Shall we move on to the next question? Okay. Anthracosis caused by inhalation of which of the following dust? It is coal dust, sugarcane dust, cotton dust, grain dust. Anthracosis is from occupational lung disease. There are possibility of question. Now we are going to discuss some important components also. Okay, yes. Come on, tell me. Height for age is shunting. Yes. So these are audience. They have commented correctly. Yes. Now anthracosis. Come on, Shikha Barman, Zoor. I'm waiting for your answer. Cotton dust. No. So here, before understanding, easily I will say sugar cane dust, baggies, cotton dust, bisonosis, cotton dust, Bicynosis. Baggies. Bagosis. Okay. When we talk about this coal dust, that is anthroposis. Coal mines. Is it clear? Coal mines. It is coal mines. Sugarcane dust, it is baggies. Bicynosis, cotton dust. So what are the other components we are going to discuss here is silica, silicosis. So what are the industries here? Granite industry, gold mines, mica, steel factory, steel industry. So which are under like sandstone industry, okay, cement factories. So there we can expect this silicosis, silica dust. Here another one important component, that is iron. Iron dust causes siderosis. So hereafter I am going to put throw the component to you people, you are going to answer. So what is for aluminium? So what is for barium? For aluminium it is aluminosis. Now it is proven that if you are using prolonged use of more than 15-20 years, if you are using aluminum utensils in your lifetime, then there is chance of cancer too. Okay, it is proven now, so be aware of that also. So when we talk about barium, it is barydosis. When we talk about stone industries alone, lithosis. It is lithosis. So now tell me what is the answer? Inhalation of the following dust. Anthracosis is coal dust. So answer is A. Sugarcane dust, bagosis. Cotton dust is bicynosis. Okay. Grain dust also comes under this sugarcane component only, but there is no proven thing. Okay. Yes. Is there any component that is for grain dust? There is one component for grain dust. Can anyone say that? It is not related to anthracosis, but anyone who is watching the video, any student can comment that for this grain dust, we are naming a component called farmer's lung. Sorry, farmer's lung. That is, yes, come on. That is moldy hay. That is for grain dust. So tobacco, you all know, tobacco dust cause tobaccosis, and sugarcane dust already I have discussed, that is bagosis. Okay. So where this cotton dust comes? Textile industries. Okay, textile industries. So next question, a community health nurse is analyzing the demographic profile of a rural, of a that is of rural population during the health planning session. The age sex pyramid shows a narrow top and wide base. They are telling about narrow top and a wide base. Narrow top and a wide base. They are telling wide base is there, narrow top is there. What are the demographic pattern indicates about the population? Yes, come on, tell me what will be the answer. Yes, come on, you are going to answer this question. because this is very important question, and most students are not answering the question. Sir, I have left this demographic question because it was confusing. See, first analyze the keyword what they have given. Here what keyword they have given: demographic profile, rural population. They have given the pyramid shows narrow top and wide. Yes, come on. See, they have given narrow, that you can see narrow birth rate, narrow top. See the birth rate and the death rate. Narrow birth rate. The birth rate is also like increasing, and the death rate is also, they are telling it is increasing. So now tell me, it is what component here? So when there is a wide base, if the word comes wide base, so what it tells? Large population of young people. Large population of young people is there. And it means that high birth rate is there. High birth rate. When there is a narrow top, fewer older individuals, it reflects high death rate. That is low life expectancy. Here we are having healthy adjusted life. Life here we are having, right? So how much life it has been affected? So there is, it indicates low life expectancy. So that is naming it as narrow top and wide base. They are telling young population, young people are more, so high birth rate. So high birth rate is also there, high death rate is also there. So what will be the answer? So the answer is B. Here I am going to explain only about the stages. So rest of the things you are going to learn of your own. So stage 1, high stationary. So stage 2, early expanding. Early expanding. So what is stage 3? It is late expanding. So what is stage 4? Anyone in the command box? Yes, low stationary. Stage 5, decline. So stage 1 is high stationary, stage 2 is early expanding, stage 3 is late expanding, stage 4 is low stationary, stage 5 is declining. Okay, is it clear? Now, when there is high birth rate and high death rate, it comes under high stationary. When the death rate declines and birth rate remains unchanged, then it is early expanding. What about the late expanding? Death rate here is declined and birth rate also falls. So where there is demographics gap starts declining is in late expanding. So India is in demographic gap in declining, that is late expanding. Okay, where there is demographic gap becomes maximum, that is in early expanding. So understanding the demographic gap now it is quite difficult, but somehow you can go through the concepts. Okay, stage 1 is stationary, stage 2 is early expanding. Okay, yes. Coming on to the stage 4, here it is low stationary. Here they have mentioned low stationary. What about low birth rate? And obviously there will be low death rate also will be there. So there will be narrow demographic gap. So coming on to the declining stage where the population becomes declined, where there will be low birth rate also, low death rate also starts declining. It comes where the demographic gap becomes negative in stage 5. Demographic gap becomes negative. So that is in stage 5. So what is the important thing? What is the answer here? High birth rate and high death rate. So that is the answer because The sixth pyramid, age six pyramid shows narrow top. Narrow top indicates what? Indicates declining of this, that is high death rate. When there is a wide base, it indicates young people. So this is the important repeated question of your nursing officer exam. So that I have given this question. So high birth rate and high death rate. So in your exam, I am expecting that they will have asked this eye stationary or late expanding, or they will mention the stages and they will ask you to explain what is this. So come on, interpret this question. Okay, or they will give this eye birth rate and right death rate. So mostly they will give on this first three components only. This is the highly confusing area. Okay, when there is high birth rate and high death rate, eye stationary. When there is birth rate is remains constant and death rate falls, okay, death rate falls, then it is yearly expanding. Okay, where the demographic gap start increasing and becomes maximum. Okay, death rate will be like reduced, declines of death rate. Okay, that is early expanding. Late expanding is like death rate declines and birth rate falls. Okay, yes, is it clear? Okay, shall we move to the next question? So this was the important thing I want to explain. You can have a screenshot so that it will be helpful for you. Okay. Yes. Stage 1, stage 2, stage 3, stage 4, and stage 5. This is high stationary, late expanding, that is early expanding, late expanding, low stationary, and decline. Okay. So what will be the next question here? The first documented patient in a disease epidemic within a population is called within a population. So index case, primary case, secondary case, and suspected case. Yes, tell me the answer. Yes, come on. Quick, quick, quick. First documented patient. Yes, all should answer. All members, you are watching this lecture, you have to answer because it is a very easy question. Very, very easy question. Yes, come on. Yes, yes, yes. Bhagya, because this gives you the motivation to attend the competitive exams. You should be active in each and every lecture, not only in my lecture, whichever platform you are just watching your lectures or you're going to learn, you should be very active. This gives you immense motivation and it gives the pleasure that I am confident my content is strong. Yes. So now tell me, what is the primary case, what is secondary case, and what is the suspected case? The first documented in the epidemic, that is index case. Easy question, easy answer. So what is the primary case and what is the secondary and what is the suspected case? Yes, come on. Yes, I'm just waiting for the answers. You should comment this question because it is very easy. You all can answer this type of question. So now, shall I explain? Let me explain this. What is this primary case? So primary case is the important, the first case of a communicable disease introduced into the population unit. First case of a communicable disease introduced into the population unit. That is primary case. So coming on to the secondary case, what is the secondary case here? One that develops disease after contact with the primary case. So that is secondary case. From the primary case, if I am getting the disease, then I am the secondary case. So what is the suspected case? So there will be features of illness. For example, I am suspecting you can always correlate that strep typhus is there, malaria is there, and dengue is there. All symptoms are same. All primary feature will be like fever. So how we can able to identify? So we are having some diagnostic measure. So I am suspecting that more than 3 days of fever is there. So there is no this remittent fever is there. The fever doesn't all not at all coming to normal. Okay, I am suspecting this patient that they may have this scrub typhus. When the word comes step ladder fever is there, then we can suspect that okay the patient is having malaria. When there is called breakbone fever, then I am suspecting the patient that can happen with dengue. So this is the important thing that you should know. Okay, basic thing. The suspected case that the patient will be having all type of features but not being particularly diagnosed. No diagnosis has been made. Okay, so that is suspected case. The first documented patient in a disease epidemic within a population that is indexed case. When the communicable disease of first case is being introduced into the population unit, then it is primary case. From the primary case, if the disease is spread, then it is secondary case. When the patient is having all sort of features of disease but not as been diagnosed, then it is suspected case. Is it clear? Okay. So now tell me next question. How many antenatal visits are recommended for a low risk pregnancy under WHO guidelines? WHO guidelines, not per our Indian guidelines. Okay. Yes. Yes, come on. Next question. How many antenatal visits are recommended for a low risk pregnancy under WHO guidelines? 4, 6, 8, 10. So I have particularly mentioned about WHO guidelines here. What is this WHO guidelines? Tells us. A for, okay, now I will be telling A is not the answer. Now come on, A is not 4 is not the answer. A is not the answer. Now tell me what will be the answer. Either it is B, C, or D. Either it is 6 or 8 or 10. So now I am going to write first trimester. First trimester, that is 12 weeks. Before 12 weeks, so there should be one visit, that is one contact. Okay. When there is second trimester, see, as per Indian guidelines, we can say that is minimum, that is we can give 4. Okay. When we talk about WHO guidelines, okay, second trimester, there should be two contacts. That is at 20 weeks and 26 weeks. When we talk about third trimester, it is 5 visits, that's 5 contact that should be at 30, 34, 36, 38, sorry, 20, 38 and 40 weeks. This is the important that you should know. Third trimester, we will be having 5 contacts. That is 12, 2, that is before 12 weeks. That is first trimester, 1 contact, second trimester, 2 contacts, and third trimester will be having 3 contacts. That is 30, 34, 36, 38, and 40 weeks. Is it clear now? So I'm slowly explaining all the concepts. Okay, I am, because for your better understanding. When we are talking about WHO, you should be clear. Okay, WHO guidelines is different. When we talk about Indian guidelines, that is different. Okay, here the question is about WHO content, WHO guidelines. So it is 8. So the answer is C8. Good evening, Vaibhava. Vaibhav. Yes, I will be talking the names which are in the commands. It is like very difficult for me to pronounce actually. Akansha Kumari, yes. Beauty Shine, Bhagya, and Vaibhav Mishra. Yes, am I right? Vaibhav Mishra. Yes, good evening. Yes, good evening. All the best for your exams. Okay, now start your preparations. I think it is nearly 45 days you are having in your hand. Nearly you are having more than 45 days, I guess. What should you do? Whatever you have learned, be confident in it. Sir, today I'm going to learn one concept. You should be thorough. For example, today you have learned about some important MCQs. In that, we have understood about this malnutrition alone. Like Z score, WHO Z score, you are confident. So each and every question, if 20 questions are coming, 20 questions you should solve today itself. All Z score question you should take and you should practice all the questions and you should be thorough. So then it will be very easy for you to analyze and answer. Okay. So this is for MSc entrance. We are planning for NOSET classes also. Will be intimated soon. And if you are having, like, you should know what are the class timing. You should subscribe our YouTube channel first, and in the Instagram also you should follow our Instagram page so that lively updates will be posted in the stories as well as the thumbnails of the YouTube, so that you can able to analyze so which is the class, so that you can plan accordingly. Okay. Yes. Okay. So coming on to the question back, is it clear? So now I am going to switch to the next question. So what is the main purpose of screening for gestational diabetes mellitus? So now tell me. Sir has given the easy question, but this is not the easy question here. The concepts which we are going to learn now is the important. thing. Okay, yes. So coming on to the screening here. So now it is easy that for gestational diabetes mellitus, and what is the important thing? It is not used for pre-existing type 1 diabetes, no. To prevent postpartum hemorrhage, no. To assess the fetal heart rate, no. So for screening is actually for to identify and manage the high blood sugar levels during the pregnancy. So coming on to the pregnant woman. So first we have to test the gestational diabetes in the first antenatal visit. First antenatal visit. So what we are going to do, we have to give 75 grams of oral glucose level, and we should assess 2 hours glucose value. Just 2 hours plasma glucose value. So the A is the answer. So that is not the concept here. Okay. Just listen. GDM testing I'm going to discuss pregnant women in the community. In the community. Okay. Now we are having positive and negative. If it is positive, 2 hours plasma glucose level, if it is more than 140 mg per deciliter, it is considered as positive. Then the mother has to be treated as per GDM guidelines, whether we are going to start medicated thing, or we are going to start insulin, or we are going to give dietary modification. Okay, yes. So it is positive. It is more than 140. If it is less than 140, 2 hours post glucose level, I am going to assess. If it is less than 140 mg per deciliter, now it is fine. Now I am going to repeat this test. So now I am writing here, I'm going to repeat the test. At which week? Anyone? Come on, anyone? At which week? Yes, come on. So it is 24 to 28 weeks. I'm going to repeat the test. Again, I'm going to do whether it is positive or negative. Yes, correct. Yes. Shika Brand, correct. Akansha Kumari, you are correct. No, it is not 20 to 24. It is 24 to 28. Okay. As per the guidelines, as per the Indian guidelines, it is 24 to 28. So again, I'm going to check whether it is positive or negative. Same thing. 2 hours plasma glucose I'm going to check. It is 140 mg per deciliter, more than 140. Now I am going to follow the GDM guidelines as instructed by the government. If it is negative, it is considered as normal ANC. See, a woman comes to the OP in the community. I'm going to assess whether the woman is having GDM or not. I'm going to give 75 grams of oral glucose in the first antenatal visit. I'm going to assess whether it is positive or negative. If it is positive, straightly I'm going to consider the mother as GDM mother. Then I'm going to follow the GDM guidelines. Then, if the negative mother is there, less than 140, then what I'm going to do, I'm going to repeat the test at 24 to 28 weeks in the second trimester. Then what I'm going to do, again I'm going to assess whether it is 140 deciliter, whether mg per deciliter, if it is less than or greater, positive or negative. If it is positive, I'm going to consider the mother as DDM. Again, I'm going to implement the guidelines. If it is negative, what I'm going to do, I'm going to consider the mother as normal antenatal mother. Okay, is it clear? Okay, fine. This is the important thing which I want to discuss so that it will give you better clarity for you all people. Okay. Yes. So now the important question: a young male come to the hospital with a clean cut wound without any bleeding. The patient received full course of tetanus vaccination 10 years ago. What is the best management for this patient? So first and foremost, post-exposure prophylaxis you should understand. Post-exposure prophylaxis you should understand. So what is here? Tetanus, post-exposure prophylaxis. Here we are having category A, B, C, and D. So what is this A category? Full immunization dose is given within past 5 years. So what is category B? That is category B we can give. Okay. Category B is greater than 5 years. The vaccine is not given ago 5 years, but it is between 5 to 10 years, less than 10 years. Okay. Coming on to the C category here, full immunization of the booster dose is given more than 10 years. It is beyond 10 years, more than 10 years. Vaccination is given, but the threshold time is gone, more than 10 years. What is category D here? That is unknown. Never taken immunization. Never taken immunization. So this is category here. So now tell me the component. Now we are having clean wound and unclean wound. If it is category A, clean wound is there. Clean wound is there. What I'm going to do? Only wound care I'm going to do, because already immunization is done and the past 5 years prophylaxis is taken, so no need to worry about that. Okay, clean wound. If it is unclean wound also, no need to do anything. Clean wound, unclean wound, no need to do anything, no vaccine, nothing. If it is category B, what is category B here? It is between 5 years and 10 years, less than 10 years. What I'm going to do, wound care I'm going to give plus single dose of tetanus toxoid, because it is a very basic question that you people, that is our nurses has to know this. Okay, nurses has to know this, because very basic question. Tetanus toxin, tetanus vaccine, where we are going to give, whom we are going to give, that is very important here. So category B, it is between 5 years and 10 years, and I'm going to give single dose of tetanus vaccine plus wound care I'm going to give. What about category C? It is more than 10 years, and I'm going to give wound care plus tetanus vaccine only for clean wound. If it is unclean wound care, I'm going to give tetanus single dose plus human tetanus immunoglobulin IG I am going to give. This is for unclean wound more than 10 years, category C patient, type of group of patients. When it is category 4, unknown, everything is unknown, I am going to give complete TT dose for clean wound, and I am going to give human tetanus immunoglobulin for unclean wound plus TT complete course. So here, what is the question? A patient having clean cut wound without any bleeding, and the patient received full course of tetanus 10 years ago. 10 years is past, so it is clean wound. What I'm going to give? Yes, come on. Now it is which category it is. First, you have to understand whether it is A category, B category, C, or D category. After that, we can answer that. First, we have to identify which category the patient is. 10 years ago, it is given, and it is a clean cut wound without any bleeding. Clean wound, they have told. So it is C category. So for C category, clean wound, we are going to give TT full course. Single dose we are going to give plus wound care I am going to give, because it is a clean wound. So the answer is single dose tetanus toxoid. Is it clear? 10 years ago they have given. If it is unclean wound, if the bird comes uncleaned, then I am going to give this immunoglobulin along with for single dose of vaccine. If the history is unknown, whether it is category D, then I can give this immunoglobulin as well as complete TT course I can give. Okay, is it clear? No, B category is between 5 years, 5 years ago, and between but less than 10 years, between 5 and 10 years. So that is category B. Here, category D is there, category C is there, but they have given 10 years ago. The keyword is 10 years ago and clean cut wound without any bleeding. So it indicates, so it is category C group. So I am going to give single dose tetanus toxoid. Okay. Yes. It is clear. Shall we move on to the next question? Okay. So, what is the elimination of a disease in a defined geographical area as a result of deliberate efforts can be referred to as? See, here they have given the patient has received a full course of tetanus course of that vaccine 10 years ago. What is the best management of for this patient? They have given clean cut wound without any bleeding. The keyword is that. So how come we can give full course of tetanus vaccine and immunoglobulin? If it is an unclean wound, then we can give immunoglobulin. Then we can give single dose of tetanus vaccine. We can consider the patient as category C. Here they have given clean cut wound. If it is unclean wound, then we can give this TT single dose and human immunoglobulin. Okay, now the answer is C only. Okay, yes. So elimination of a disease in a defined geographical area as a result of deliberate efforts can be referred to as. Yes, come on. Yes, come on. Elimination of a disease is defined in the geographical area as a result of deliberate efforts can be referred to as. Is zero incidence of a disease. When the word comes elimination in the sense complete disease has been eradicated. Okay, eradication is different. Okay, eradication is totally different. Elimination is there is no new cases. Already there will be prevalence, but elimination of a disease is zero incidence of a disease. So that is called what? Elimination of a disease. Okay, is it clear? Okay. Shall we move on to the next question? A 40-year-old woman has 7 skin lesions, thickening of the ulnar and posterior tibial nerves, and a positive split skin smear. What is the correct classification? What is the correct classification here? Whether it is paucibacillary, multibacillary leprosy, or it is tuberculoid leprosy. Yes, come on. Our last question for the session. Yes, come on to see. Okay, if it is more than that is, if it is between 1 to 5 lesions, no nerve involved, then it is paucibacillary leprosy. So, what about this intermediate leprosy? When there is a few well-defined hypopigmented patches with minimal nerve involvement is there, but this split skin, that is slit skin smear, will be negative. Then it is intermediate leprosy. When we talk about multibacillary leprosy, the lesions will be more than 5, and there will be more than 2 or 3 nerve involvement, and there will be positive slit skin smear. What about possibacillary here? Negative. Slit skin smear will be negative. So coming on to the tuberculoid leprosy, there will be well-defined lesions, strong cell-mediated immunity will be there, and generally the smear will be negative in tuberculoid leprosy. This associated with tuberculosis. Okay, yes, that is the major difference. But they have given 7 skin lesions, still positive slit skin smear. So it is multi-bacillary leprosy. Easily you can able to identify. Is it clear? Okay. So it is caused by Mycobacterium leprae. Okay. The major thing, the categorization is very important, whether it is possibacillary leprosy or multibacillary leprosy. Okay. Yes. It is clear. Okay. So that's all about the today question. That is MCQ discussion about this for the MCQ entrance, especially also for the nozzle. Okay. We will be having further sessions and will be intimated soon. Okay. All the best for your exam. Keep learning. Keep motivated yourself, and everything is in your hands. Learn at proper platform. Learn properly. So don't learn all the concepts. If you're learning one good concept or 10 good concepts, that should be in your mind. Okay. Very all the best from my side. Okay. Thank you all. See you in the next session.